Thank you, Kimmy. Well, November is Gluten-Free Diet Awareness Month. So all month long, or all week long, I should say, we're trying different things to help you live a better gluten-free life because it can be really hard. Luckily, there are things out there that make it easier now. So this morning, how do you even change your diet or know if you have to change your diet? Well, we are talking this morning live with Dr. Bronwyn Carlblom with the Southwest College of Naturopathic Medicine. Thank you so much for joining us this morning.
Thank you for having me.
Let's first talk about gluten. We hear it. It's commonplace where you hear a GF life. What exactly is gluten, first of all?
Sure. Gluten is a protein, or a family of proteins, rather, that are found in grains, most commonly associated with wheat and wheat products. They're what make our food sticky, which is why it's so commonly used in baking.
And why would someone need to start eating items without gluten? What is it that makes gluten problematic for some people?
There's a number of things, actually. The most common medical reason is a condition called celiac disease. And this is an autoimmune inflammatory condition where someone has almost an allergic reaction to that gluten protein. It causes all sorts of trouble, unfortunately, significant abdominal pain, bloating, diarrhea, fatigue, and can actually lead to permanent damage to the intestines. Now, outside of that, there are several other reasons why someone might avoid gluten. We have a umbrella term that we use for people who suffer symptoms from eating gluten that don't have celiac disease, and that's called non-celiac gluten sensitivity. And then there are others who just find that they feel better when avoiding gluten, even in the absence of some discrete symptoms.
I've heard that a lot from people, and it's interesting because more than 3 million Americans follow a gluten-free diet. So it's not something that's just a fad. It's not something that, is new and just recently become popular. What's the best way then to get tested to also know if you should be avoiding it, if it is causing harmful effects in your body?
So definitely something you want to talk to your doctor about. Here at SCNM, we're able to go through that workup with you, determine whether you do have a celiac disease or just another type of gluten sensitivity. But yeah, there's some simple blood work that we do first to evaluate for celiac disease, which is going to be the most important thing to rule out. And then there's other testing involved, looking for more of a gluten sensitivity, elimination diets, all sorts of things that your doctor can work you through.
All right. Well, thank you for giving us a heads up on what exactly gluten is and why a gluten-free diet would be beneficial to anybody out there. Dr. Carlblom, we appreciate your time this morning. Have a great day.
Thank you so much. You too.